Good morning, everyone, and thank you for joining us today. My name is Tom Burke. I serve as the president of St. Francis Hospital, and I'm happy to welcome our community, our colleagues, and our honored guests in attendance here this morning during Child Abuse Prevention Month as we discuss the Safe Haven Act. I want to welcome again to St. Francis Lieutenant Governor Susan Bysiewicz. Your dedication to health and wellness in the state of Connecticut is exemplary, and we thank you for your ongoing commitment. Thank you also to Connecticut Department of Children and Families Commissioner Vannessa Dorantes for your dedication to improving the well-being of children and families across our state. I also want to thank Carl Schissel, Director of Regulatory Advocacy for the Connecticut Hospital Association. Running a little bit late, Senator Doug McCrory, and also here this morning, Senator Lisa Seminara, for joining us here this morning. A special thank you to our own Dr. Carrie Ann Silverman, Chair of OB and Gynecology here at St. Francis, for joining us as well. And as you know, here at St. Francis, we strive every day to live our mission as a compassionate, healing, and transforming presence in our community. And as part of that work, we are dedicated to supporting our local communities and providing care for those neighbors who are most vulnerable. One way we do that is by being a safe haven, opening our doors to parents who are unable to care for their own newborn baby for any number of reasons, whatever they may be. With the Safe Haven Act, those reasons just don't matter. We are proud of the compassionate and equitable care that we offer on a daily basis. Our emergency department and New Beginnings family birth care physicians and nursing staff are trained to care for any woman and newborn in the most difficult of circumstances. Our nurses serving on the front lines over the past few years are incredibly dedicated to taking care of each and every patient who comes through our doors with a level of dignity and respect that they deserve. And I can't thank them enough for their ongoing commitment to our patients and our community. You're going to hear from one of our incredible nurse leaders, Ivan, in just a few minutes. But right now, I'm honored to welcome Lieutenant Governor to the podium.
President Burke, thank you so much for hosting us this morning, and thank you so much for the great medical care that you provide. I'm so delighted to be here to celebrate the passage of the Baby Safe Haven Act, and that happened 22 years ago, and this program has saved lives. How many? 52 babies in Connecticut have been saved under this important legislation that was the brainchild of then State Representative Pam Sawyer, who I have the pleasure of serving with in the state legislature and as Secretary of the State. You know, we've heard and we sometimes read about these very heartbreaking stories where an infant is found in a trash can or left somewhere in an unsafe place. And so this addresses the concern that moms might have who deliver a baby and find, for whatever reason, that they can't raise that baby or take care of it. And so when they have nowhere to turn, they should know that they can go to a hospital. That is the safe haven. Under the program, a parent can anonymously give up a newborn. They can give it to hospital staff. The baby will be safe and cared for. The parents are notified of what their rights are, and the mom will not be charged with abandonment. And this can save the life of not just the baby, but also the mom. So I am here today to say thank you to the advocate and the person who championed this bill, and it is my pleasure to introduce First Select Woman Pamela Sawyer.
Governor, thank you very much. It was 1988. It was a very cold beginning of January. And it was a time when people read newspapers a little bit more than they do today. I was at home with a young family, and there was an article that chilled me deeply. I was alarmed to read of a newborn that had been abandoned under a tree next to a parking lot and froze to death. How could this happen? That event shocked that community deeply. That baby was named by the community. Someone donated a casket. Someone donated a gravesite. And to this day, January 2nd, that community goes usually the first responders will gather at that gravesite in Meriden. It's one of those stories that stuck with me because of my immediate fast reaction to it, I suppose. 11 years later, I was a legislator, and I read in the newspaper that Texas had come up with this law of safe haven, having a safe haven law. Do you know that that concept grabbed hold across the country, and now all states have a safe haven law as well as our territories? Connecticut decided, I went in with the help of a lot of friends, 187 to be exact, I think. And you talk about it, and 201, there was an understanding that this could be amazing public policy, where you give an opportunity for someone who is in such distress and such panic, a place to go. And they're protected, and the baby's protected. And it doesn't have to necessarily be the mother, it could be mother and father, it could be someone else. It could be a religious person that brings in the baby. So these stories go on that we were able to pass this out, and we thought we were so smart. We made a very deep mistake. We forgot to tell everybody about the law. It was in June 1st, it was the crush of legislative session, of which most people will nod and say, And so that was a bit of a problem. In 2004, when Lieutenant Governor was serving, we found that if we put some money towards our very hardworking agency, DCF, they became a partner in putting out flyers and posters and getting the word out. Well, that worked out very well. There were a number of babies that had been abandoned from 2000 to 2004, but it stopped. And we started having the success stories. Well, we had a problem. I was alarmed again and had that same deep chill as I was leaving the General Assembly. It was the end of my last term. I had decided to retire, and it was my birthday. It was August. Why would I get this amazing visceral reaction? Did I get so cold because a baby had been found in a trash can in East Hartford? A full-term baby boy. What have we done wrong? We thought we were doing the right things, coming up with a plan, coming up with advertisement, coming up with outreach, but that had sort of fallen off. And what happens? The next generation that comes up has the need to know. So, not being too shy, started calling friends and more friends, calling people from private and public agencies and companies to come together and create a partnership, a working safe haven group to figure out what we could do about it. How do we change this? How do we fix this problem getting to the next generations? So I was blessed to work with a number of people, including some behind me, and the partnership with the Connecticut Hospital Association, and others, department agencies and private citizens. And we passed legislation that has now being taught in the schools as well. How to reach out to those from immigrant communities, how to reach out to those who are in the need to know in future generations. So at this time, I'd just like to say a very special thank you to everyone who's standing behind me. Some are from the working group, some are been very close partners in the vision to save not only the baby, but the mother or parents from being prosecuted. Thank you very much.
Good morning, my name is Bysiewicz. I'm the nurse manager in the emergency department here at St. Francis Hospital. Thank you for having me here today. I would like to extend my thanks to all of you for being here today. It is our honor to welcome Lieutenant Governor Bysiewicz, Commissioner Dorantes to St. Francis today to recognize the mission that we share with both of you of providing life-saving care. Today, I would like to talk about the Safe Haven Act and what a parent or guardian can expect when they come to the hospital in need of the act. Under the act, the parent can voluntarily give up custody of an infant who is 30 days or younger to the nursing staff of the hospital emergency room. The parent can do this confidentially without any involvement of law enforcement. When a patient arrives to the ED with the intent of using the Safe Haven Act, one of our nurses will bring them to a private area and ask about the infant's medical history. An ED physician will do an initial medical exam, and the infant will be closely monitored by nursing staff. The nurse will ask the parent's name and information, but it is not required that the information is provided. The parent will be given a Safe Haven folder, which contains educational materials, including information to contact the Department of Families and Children if there's any questions or if the parent changes their mind after leaving the emergency department. Once the infant is admitted to the hospital, the nurse will call DCF and notify the department that a Safe Haven baby has arrived. From there, DCF will assume custody of the infant. The Safe Haven Act saves lives. It gives parents who might feel like they have no other choice a responsible option that will ensure the best care for their child. The St. Francis Emergency Department is here for any member of our community who needs to use the Safe Haven Act. I, in fact, have been part of one of these cases in the past, and it was near and dear to my heart seeing this happen, but I was happy to see that we can help both the parent and the child. For whatever reason, our nurses and doctors at St. Francis will accept the infant, provide incredible care, and support the parent in their decision. Thank you all for sharing the message that we at St. Francis hold to our highest regard of providing passionate care to our community. I am honored now to introduce Carl Schechel, Senior Director of Regulatory Advocacy at the CHA.
Thank you, Ivan, and thank you to St. Francis Hospital for being a leader among hospitals with respect to the implementation of the Safe Haven law. And I had the privilege of serving in the General Assembly, with Lieutenant Governor Bysiewicz and former Representative Sawyer. And you have this great feeling when you passed a good bill. And I think Pam described how the world works for a legislator. You think once the bill's passed, the job is done. But really, that's when the job is just beginning. And with the Safe Haven law, we think we've got the right law on the books. We know it works. And so the challenge now is to keep refreshing and renewing the message and demonstrating our commitment to fulfilling the potential for that law. And so it's events like this. Every year on Safe Haven Baby Day, we get together and talk about this thing, and we're trying to get the message sent in the schools. At the same time, I think about how the real world works. When someone's in distress, they're typically, not making phone calls or doing research necessarily in that moment. In that moment, they act out of desperation. So one of the reasons we try to emphasize the existence of the bill and the need for people to know that they can save their babies, save their newborns, even if they elect not to raise them, without liability is an important feature of this law, and we need to send that message to every generation to make sure they know that there's an option if they become desperate to resolve their situation, save their newborn, and not risk personal liability. The person on the street probably doesn't know about this law, and so every moment we can take to send this message is an important moment. And I should tell you that all 37 licensed emergency departments in the state of Connecticut have demonstrated their commitment to fulfilling their obligation under the law. But each year, as we commemorate the passage of the law, we charge every one of us to spread the word and make sure people know when they're in distress that there's an option for them to save their newborn child. So I'm proud and privileged to be part of this community. I'm again grateful to St. Francis Hospital for being a leader in the promotion of information and knowledge about this issue. And I look forward to continue working not only with the individuals here on the podium, but with every one of you to try to get the message out and keep the message flowing. So thank you, everyone. At this point, I'd like to introduce Senator Lisa Seminara, the ranking member of the Committee on Children. Senator.
Thank you so much for having me this morning. I want to thank Lieutenant Governor Bysiewicz, the Department of Children and Families, and St. Francis Hospital for recognizing the Child Abuse Prevention Month. I also want to acknowledge the importance of Connecticut's safe haven law and for providing women with this option. The Bible tells us in 1 Corinthians 16, "Let all that you do be done in love." Giving a child hope and an exceptional future through sacrifice is the essence of a mother's love. We all hope for the best of our children. We hope that they will be happy and healthy and experience life to the fullest. From the moment they are born, every decision we make has our children's well-being and future in the forefront. I commend the Baby Safe Haven law because it does precisely that. It allows mothers who may not have the support or resources to make the selfless and life-changing decision to give their child a better life without fear of judgment or penalty. As a mother of 3 incredible children, I couldn't imagine the pain of giving up a child. This decision is incredibly difficult, and I would argue it is made with the type of divine love only a mother understands. Connecticut's safe haven law allows women to give their newborns the greatest gift of all, the gift of hopeful and prosperous future. Finally, I would be remiss if I did not thank the highly qualified nursing staff of St. Francis for caring for these children until the proper arrangements can be made. Your work means more to these newborns and their futures than you will ever know. Thank you.
Commissioner Dorantes, our amazing leader of the Department of Children and Family.
Thank you so much. Thank you so much, Lieutenant Governor, and thank you, First Selectman Sawyer, for your persistence and dedication, because this is not just talking the talk. This is absolutely walking the walk, and I have to acknowledge the tremendous healthcare professionals here at St. Francis and across Connecticut for the dedicated work for those 52 babies you just heard about. Just to give you a little bit more data as it relates to Safe Haven, over the pandemic, so those 2 years of 2020 and 2021, there were 9 Safe Haven babies. Last year, there were 2. This year, there have not been any. And so while we look at statistics that decrease like that as a positive, if you heard the sentiment of making sure we're raising awareness, in this situation, the 0 may not be a good thing. We need to make sure that if you are listening to this particular message, whether it's with our media partners or those who are physically present, that everyone tells someone who can tell someone else. Our message is not just to those who can hear the stories, but to that person who feels isolated and alone. That person who feels the level of desperation that would lead them to leave a child in an unsafe space. These are not just teenagers. We need to make sure that this message goes to anyone who is experiencing this uncertainty around raising the child. As the Commissioner of the Department of Children and Families, nothing is more sacred than the lives of our children. And this month, April, as Child Abuse Prevention Month, is an absolutely wonderful time to raise awareness to not only the Safe Haven Act, but any reasonable suspicion of abuse or neglect. So our 24/7 care line is 1-800-842-2288, because it takes a village to make sure that all of our children in Connecticut thrive. Thank you.
So we thank our media partners for coming, and we'd be happy to take any questions.
Commissioner Dorantes, to your point about that perhaps it's not a good thing that we've seen zero babies come in through this lot, do you see in years where there are few babies surrendered, do you see increased cases of child abandonment?
It's hard to make the correlation, but certainly what we are seeing now on post-pandemic is an increase of the calls to our care line. So we definitely have seen the reasonable cause of suspicion go up, and we also see a significant number of anonymous calls coming into our care line. So about 65,000 last year were accepted calls.
Thank you. I can ask you.
Yeah, sure, go ahead.
Lieutenant Governor, these laws have sort of been discussed nationally in the context of the anti-abortion movement. Given Connecticut's status as a safe harbor state, how does that affect the way you're thinking about this law with the national context?
Oh my goodness, well, we are, first of all, I'll say that Connecticut has been a leader. Pam Sawyer, thank you so much for your vision and for seeing one state do it and saying Connecticut should join. We in Connecticut want people to know that we are a safe haven for women who need reproductive health care. We are waiting to see what the Supreme Court does over the next couple of days, because a decision is anticipated. But no matter what happens at the federal level, the governor and I and the attorney general are very committed to making sure that no matter what happens, that we provide reproductive health care for women. And if a certain type of health care is illegal in another state, we want women in America to know that they can come to our state for that care, and we want the healthcare providers in our state to know that they can give that life-saving and critical care without fear of prosecution.
I have one more.
Sure.
This I think is likely for Commissioner Dorantes again. What happens if a biological parent who surrenders their baby changes their mind?
So if they change their mind, because it's a time of uncertainty, there is an opportunity for my family assessment workers or investigators to meet with that parent and to talk through all of the options of connecting families to our tremendous group of community providers across the state that can offer parenting support. Do you want to offer a little bit more on that, in terms of what happens on the other side? There you go.
It was an important piece of the legislation initially, that when someone comes in to surrender the baby, they are giving a matching wristband to that's put on the baby. And they have another 30 days if they wish to come back and begin the process of possible reunification. And it is the person with the wristband that can make that ask. And DCF has a very thorough process for vetting, and it's carefully done. And we do have cases where it has worked beautifully, and there are other cases where it's unable to be done for various legal reasons. But the anonymity isn't so important for the protection of the surrender person, the mother, the father, and for the infant.
Anybody else? We thank you so much for coming today.